Okay, ma'am. Good morning, ma'am. Ma'am, shall we start, ma'am? Ma'am, shall I start, ma'am?
Yeah, ma'am. Good morning.
Oh, good morning, ma'am. Ma'am, principal madam, she went for an urgent meeting, ma'am. She will join later, ma'am.
Who?
Principal madam, ma'am. Our principal madam.
Coming?
Yes, ma'am. Later she will join within a few minutes, ma'am.
Okay.
Okay, ma'am. Thank you, ma'am. A very good morning to one and all for today's webinar organized by Sri Vidyaniketan College of Nursing in association with NSS unit. I am Mrs. R. Leelavati, Assistant Professor in Sri Vidyaniketan College of Nursing as well as webinar coordinator. There is always hope beyond what you see. It's possible not just to survive, but to thrive and to live a healthy, wonderful life again. Life is 10% what happens to us and 90% how we react to it. Cancer is like a teeter-tooter. World Cancer Day is a leading international awareness day observed every 4th February. 10 million people each year die from cancer. It is the second leading cause of death worldwide. Today, we all gather together in a Zoom to make awareness on National Cancer Day and how to make screening and diagnose cancer. Kusma, madam, kindly mute. Today's topic is screening and diagnosis of cancer. I am very thankful to our college management team for granting permission for webinar. Being a good leader is not about having power over others, but about instilling power in others. She is none other than our Honorable Principal Madam, Dr. P. Pradima. We all very thankful to her to make this event a great success. This World Cancer Day, we recognize the power of knowledge. We know that every single of us has the ability to make a difference, large or small, and that together we can make real progress in reducing the global impact of cancer. This 4th February, we all call on you, whoever and wherever you are, to play your part in creating a cancer-free world. Close the gap in cancer care. Half the world's population lacks access to the full range of essential health services. World Cancer Day's new 3-year Close the Care Gap campaign theme 2022 to 24 is about identifying and addressing the barriers that exist for many people around the world in access the care they need. Now, I request Mrs. V. Kusma, Assistant Professor in Sri Vidyaniketan College of Nursing, to deliver welcome speech. I request Mrs. V. Kusma, ma'am, Assistant Professor, to deliver welcome speech.
Good morning to each one of you present today. It's a moment of extreme pleasure to welcome the guests who are present here. It's a glorious moment to extend a warm wishes on behalf of Sri Vidyaniketan Educational Institutions. It's a great pleasure and honor for me to welcome our Principal Madam Dr. P. Pratima for today's webinar. We welcome you, ma'am. It's a honor and privilege for me, and I take this opportunity to welcome for today's resource person, Mrs. K. Varalakshmi, Associate Professor, SWIMS, Tirupati. We welcome you, ma'am. Last but not least, I heartily welcome all the faculties of nursing colleges, nursing students, research scholars, and webinar committee members in Sri Vidyaniketan College of Nursing for joining webinar. I welcome all the participants and hope you will be well benefited through this webinar. Once again, welcome you all participants this webinar. Thank you.
Thank you, Mrs. V. Kusma, for your warm welcome. We realize the importance of voices only when we are silenced. Now, I request Mrs. Harita, tutor, to share the profile of our resource person in few words.
Good morning, everyone. Myself, Mrs. P. Harita, working as a nursing tutor in Sri Vidyaniketan College of Nursing, Tirupati. It's my glory to expand the profile of today's resource person, Mrs. Kannamagari Varalakshmi Garu, Associate Professor, Sri Venkateshwara Institute of Medical Sciences, Tirupati. So, Madam completed her BSc Nursing in Government College of Nursing, Kurnool in the year of 1992 and MSc Nursing in Maternity Nursing from Manipal Academy of Higher Education from Manipal, Karnataka in the year of 1998 and currently Madam pursuing PhD at Sri Padmavati Mahila Vishwavidyalayam in Department of Home Sciences. Madam had a 24 years and 6 months of experience as an academician. Madam worked as nursing tutor in Saptagiri School of Nursing for 2.5 years and worked as an assistant lecturer for 4.5 years in SVIMS, Tirupati. After showing her excellence in teaching, she moved to West Indies and worked as a nursing tutor RN grade 4 in Cornwall School of Nursing Hospital in Montego Bay, Jamaica, West Indies. So after return to India, again Madam worked as a principal nearly 1.5 years in Kammanalli St. Mary's College of Nursing, Karnataka. At present, Madam is working as an associate professor in SVIMS University, Tirupati since 2011. As an educationalist, Madam attended more than 20 conferences and published 33 research articles. Thank you, ma'am.
Thank you, Mrs. Harita. Now, I request a great and dynamic personality, Mrs. K. Varalakshmi Madam, Assistant Professor, SVIMS, Tirupati, to start the session. Please, ma'am.
Good morning to one and all. And thank
morning,
you for the introducers of the today's webinar. And I'm glad to be with you today to talk something about the cancer diagnosis and screening. So we all will know about the cancer nowadays. It is a worldwide problem which is faced by all the people in the world. So we all know that cancer is uncontrolled growth of cells in any part of the body. Cells become more and more abnormal. Older damaged cells alive when they should die, and new cells form when they are not needed. These extra cells can divide without stopping and form growths called tumors. These tumors can be either benign, which are harmless, or malignant, which is harmful in nature. Now we will see cancer facts that are existing according to 2020 statistics. Cancer is the leading cause of death worldwide, accounting for nearly 10 million deaths in 2020, or nearly 1 in 6 deaths. The most common cancers are breast, lung, colon, rectum, and prostate cancer. Around 1/3 of deaths from cancer are due to tobacco use, high body mass index, alcohol consumption, low fruit and vegetable intake, and lack of physical activity. Cancer-causing infections such as human papillomavirus and hepatitis are responsible for approximately 30% of cancer cases in low and lower middle income countries. Now let us see good old slogan which we are hearing from years together as caution of cancer. All of us know very well about what is caution. C indicates change in bowel and bladder. A indicates a sore that doesn't heal. U represents unusual bleeding or discharge. T shows that thickening or lump in breast testicles or elsewhere. I indicates indigestion or difficulty in swallowing. And O stands for obvious change in color, shape, and thickness of a wart or mouth. Then N indicates nagging cough or hoarseness and presence of persistent headache. These are some of the things which are abbreviated as caution. So we have to be very cautious about these caution symptoms so that we can easily identify these symptoms of cancer nowadays. So let us go to the early diagnosis. So we all know prevention is better than cure. So before getting or before attaining this cancerous disease, we can have some certain precautions or we can follow certain measures to prevent and also to detect early this dangerous disease. So let us see what is early diagnosis. We have, in this cancer diagnosis, we have mainly 3 steps, step 1 and step 2 and step 3. Let us see what is early diagnosis means. Early diagnosis aims at reducing the proportion of patients who are diagnosed at late stage. There are 3 steps to cancer early diagnosis. Barriers exist during each of these 3 steps and interventions are needed to address delay in care. So that's why we have to be cautious in identifying this cancer in early steps itself, that is step 1 and step 2, not to go further to step 3, where the disease will be prevailed heavily. So let us see what is step 1 and step 2. We are now going to discuss only these 2 steps. That is step 1, which carries awareness and accessing care, and step 2, clinical evaluation, diagnosis and staging. We are now going to discuss only these 2 steps. So let us see first step 1. Under that we have awareness on cancer. If we take the gender, male and female, so the males are having certain specific cancers and females have certain specific cancers more in our country. So let us see what are the prevailing cancers apparently among males and which are causing for some warning signs. So whenever we identify these warning signs, we have to be very cautious to go for checkup or to approach the health team for further diagnosis. So let us see first in males. In males, head and neck cancer, number 1. So in the head and neck cancer, we have to check for the warning signs as follows. That is swelling or sore in the throat, red or white patch in the mouth, lump, bump or mass in the head or neck, persistent sore throat, foul mouth or odor, hoarseness or change in voice. So these are some of the warning signs that we should keep in mind. Being healthcare personnel or being health team members, we have the main responsibility on our shoulder to teach the public or to bring the awareness among the public regarding these warning signs so that they will be very cautious to approach the doctor immediately whenever they have identified these warning signs. So children as well as the staff, please be cautious to teach or to educate the public regarding the awareness of cancer on all these aspects. Number 1 is head and neck cancer. Number 2, oral cancer. Oral cancer, the warning signs are a sore, irritation or thickness in mouth or throat, and presence of white or red patches on the side of the mouth. And third one is hoarseness of voice. And fourthly, difficulty in chewing, swallowing, or speaking. And fifth one is difficulty in moving jaw or tongue. So these are some of the warning signs which we can educate the public regarding oral cancer. And next one is lung cancer. The warning signs are cough that does not go away. Second one, coughing up blood or rust-colored sputum. And hoarseness is the third one. And fourth one is loss of appetite. Fifth one is unexplained weight loss. Nowadays, people are trying to lose their weight. And apart from that, if without trying for reducing weight, if the person has loss of weight, that is one of the indication of the cancer in the body. And sixth one is shortness of breath. And last one, feeling tired or weak. So these are the warning signs of lung cancer. Coming to the gastric cancer, poor appetite, weight loss, and abdominal pain, that is in the belly, above the upper abdomen, that is. Next is vague discomfort in the abdomen, that is above navi, that means above the navel area, and feeling full after eating only a small meal. After eating little amount of food also, the client feels heaviness in the stomach, heartburn or indigestion, nausea, vomiting with or without blood, losing weight with or without trying. So to give you an example, I had a patient from Madanapalli recently diagnosed as gastric cancer, who told his history that he used to get often that stomach fullness after eating a small amount of food, and he used to have pain in the upper abdomen and weight loss, all those things he said. But he said that I usually used to take soda and also what is that, in advertisements, whatever they will get. All those things he tried and tried for 3 to 6 months, and later he came to our hospital and being diagnosed as cancer stomach in the 3rd stage. Friends, I want to tell you, this cancer is spreading widely, so widely, like our population, how it is increasing. So that's why we have to be very cautious to reduce this by identifying this in the initial stage itself. Within the span of 3 to 6 months, it came to the 3rd stage. That's why we have to be very cautious to educate the people regarding our warning signs, which we are expecting them to know very well. And next cancer is colorectal cancer, that is change in bowel habits. That means either constipation or they may have the diarrhea or frequent stools. And feeling of bowel movement that is not relieved by having one. That means if the person will defecate, again they will have the feeling of the fail to defecate again. So the complete fecal matter will not be emptied by the person. That type of feeling the person will have. And rectal bleeding with bright red color. Rectal bleeding with bright red color, and cramping or abdominal pain, weakness or fatigue. So apart from this, again we can have the weight loss and also discomfort in the abdomen. Prostate cancer. In this prostate cancer, the males will have the frequent urination, weak or interrupted urine flow, hematuria, erectile dysfunction, and dysuria. So these are the dysuria means painful urination or discomfort in urination. So these are some of the warning signs the person who has prostate cancer will exhibit. Next one is testicular cancer. In the testicular cancer, there will be presence of pain during sexual intercourse, a lump in either testicle, and a feeling of heaviness in the scrotum, a dull ache in the abdomen or groin, a sudden fluid collection in the scrotum, and pain or discomfort in the scrotum or testicle, and presence of back pain. So these are some of the warning signs in the testicular cancer. Next, we will go to the females. Among females, we are having the breast cancer is the primary one, and the second more prevalent one is cervical cancer, and third one is ovarian cancer. So let us see the warning signs in the cervical cancer. Bleeding after intercourse, and second one, abnormal vaginal bleeding that can be heavy bleeding for many days or extended period of cycle. Okay, and abnormal vaginal discharge. That means the women may express that she has some sort of discharge from the vagina, which has different characteristics like the color change, as well as the consistency changes, as well as the odor changes. So she can express either in the form of the change in the color, consistency, and odor of the discharge from the vagina, and presence of pelvic pain and unexplained weight loss. So these were some of the warning signs related to cervical cancer. I'm coming to the ovarian cancer. The women may feel bloating. Bloating, there will be gas-filled abdomen, which will have certain type of discomfort. Okay, bloating will be there. Always there will be flow of gas within the abdomen will be observed, and abdominal or pelvic pain, presence of abdominal or pelvic pain, and change in bathroom habits, that is urination as well as defecation. There will be change in the defecation and urination habits. That means the women may have urge to pass many times urine or pass the stools many times. Like that, she may have the change in the habits of bowel and bladder expulsion. And presence of back pain. The women may have back pain, and she may also have the appetite change. Change in appetite means there is a loss of appetite and not able to eat properly. So weight loss is again another warning sign that can be present. Next one is breast cancer. In breast cancer, the women may experience lump in breast or underarm, and thickening or swelling of part of the breast, irritation or dimpling of breast skin, redness or flaky skin in the nipple area, pulling of the nipple or pain in the nipple area, any discharges from nipple. So these are some of the warning signs that can be identified. Now let us discuss about the preventive aspect. So here we have 10 commandments to prevent cancer. So we have to educate the public to eat well-balanced diet. So they have to be educated to eat whole grains, plenty of pulses, vegetables, fresh fruits, green leaves, and consume plenty of fluids and adequate fiber containing food items. So we have to explain them and educate them regarding well-balanced diet consumption. And they have to practice regular exercises like 30 minutes brisk walk or moderate physical activity 3 to 5 times weekly. So this is very important to maintain their habits to have the regular exercise pattern. Next one, maintain healthy weight. That means we should not put on weight. We should not be obese. So we have to maintain our BMI 18.5 to 24.9 according to our body height and body weight. So body mass index needs to be maintained in between 18.5 to 24.9. And we have to educate them to avoid dietary saturated fats like the beef, pork, lamb, and dark chicken, as well as meat, poultry skin, and whole milk, butter, cheese, coconut oil, and palm oils, etc. So this contains more saturated fat. That's why we have to ask them to avoid these food items which have saturated fat. And also salt cured meat with high nitrate concentration. That means stored meat items which they will be consuming, and those items also need to be avoided. And they should have consistent periods of rest. So everyone should have at least 6 to 8 hours of a nice sleep at night. And also if they require, they can have a relaxation period of 1 hour during afternoon, 1 to 2 hours of relaxation. And they have to be away from the stress and stress causing factors from life. So every individual in the world is at stress because of their unmet needs or because of their ambition or whatever it is. They are consuming more stress and they are not able to relieve the stress from the life. So we have to educate them. They have to be stress-free and they have to keep the stress-causing factors away from the life. So they have to follow certain measures to cope with the stress, like meditation, relaxation, music, and yoga. So all of us can enjoy these type of items to relieve our stress from our body. And be familiar with family history and risk factors of cancer. Everyone should be focused on their family history of cancer so that they'll be very alert to have checkups in early stage itself to avoid certain types of cancers which run from family members. And avoid exposure to carcinogens like chemicals, viruses, insecticides, drugs, radiation, and sun rays, heavy sun rays. So we have to avoid certain climatic changes as well as viruses which are causing for these cancers, and also insecticides which are used for the production of the crops like vegetables, and also for the cereals and pulses, and for everything they are using nowadays is insecticides. So we should not utilize those type of insecticides. That's why everybody nowadays are concentrating on the kitchen garden, as well as they are producing their own vegetables without using this type of insecticide. So that is very good thing which everyone is now diverted towards the kitchen gardening. So we have to encourage them to avoid exposure towards the carcinogen and avoid consuming cancer promoting agents. Those are like active and passive smoking, alcohol consumption, and dietary fat, obesity, and physical inactivity. So all the people should avoid all these things to be away from the cancer. Now, we are coming to the second step, that is clinical evaluation, diagnosis, and staging. Step 2. Okay. So in the step 2, now we are having, according to American Cancer Society guidelines for early detection of cancer, it is being given like this. So the type of cancer among women regarding breast cancer, so we have to educate the people to have their own breast assessment. So here, women aged 40 to 44 years, they should have frequent breast self-examination, and they also should undergo mammogram. So in the women aged 45 to 54 years, they should undergo breast self-examination and also mammogram every year. And women above 55 years as well as 55 and above, they should have mammogram every 2 years or yearly once of mammogram. So here, women with family history of breast cancer should also have MRI along with this mammogram and breast self-examination. This is regarding breast cancer. And second one, colorectal cancer. Among men aged 45 and above, they should check for warning signs as we have discussed earlier, all those warning signs, that is change in the bowel movements as well as the presence of blood in the feces as well as other things which we have discussed in the warning signs. Coming to the cervical cancer, below 25 years of age, we should not do any type of diagnostic procedures on the women below 25 years. We have to start investigating after 25 years to 65 years. That is, we can do primary HPV test every 5 years. And we should undergo, if primary HPV is not available, we should go for co-test like HPV plus Pap smear test for every 5 to 3 years, 5 years or 2 years. If the women above 65 years who had regular tests negative for past 10 years should not be tested again for cervical cancer. There is no need of testing. If the women had continuously for past 10 years, there is negative report of HPV. Next, if tested positive with pre-cancerous stage, then she should continue the test for at least 25 years after the diagnosis, whose cervix is removed, whose cervix is removed by surgery should not be tested. This is third point, that is continuously typed, that is typographic error. So the women who has regular testing with a negative test for 10 years, there is no need of testing. If the tested positive women with the pre-cancerous stage, she should continue testing for 25 years after diagnosis. And the women who has cervical removal by surgery also should not have the test. These are the three varieties of the group of women above 65 years who should follow the regimen for the testing. And people who have been vaccinated against HPV should also be allowed for screening recommendations, as we have discussed from 25 years above, how they have to undergo. All those things need to be tested among the women who had HPV vaccination. Now, lung cancer, 50 to 80 years old who are fairly with good health and currently smokers, or who had quit the smoke for past 15 years. So here, the lung cancer testing, we have to start above from the age of 50 to 80 years, who have good health, fairly good health, and currently if they are smokers or who have stopped the smoke for last 15 years. So from those people, we have to collect the 20 packs per year smoking history. That means how many packs of cigars they used to smoke per day. That we have to calculate, and based on that, 20 packs. So 20 packs means 2 packs if they are smoking per day into 10 years is equal to 20 packs per 10 years. Did you get my point? 2 packs of cigarettes కాలుస్తున్నట్లయితే into 10 years వేసుకొని మనము ప్యాక్ అంటే 20 ప్యాక్ హిస్టరీ అనేది ఎలా కలెక్ట్ చేయాలి అంటే డైలీ 2 ప్యాక్స్ కాలుస్తున్న వాళ్ళు into 10 years is equal to 20 packs for 20 years అన్నది హిస్టరీ మనకి వస్తుంది. అలాగే ఇఫ్ దే ఆర్ స్మోకింగ్ 1 pack into 20 years, that means ఒక ప్యాక్ కాలుస్తున్న వాళ్ళు into 20 years is equal to 20 packs for 20 years. ఇప్పుడు ఈ 10 packs 2 packs for 10 years, 1 pack for 20 years, both will have the same effect. That means, so 2 packs 10 years వాళ్ళకి 10 years of age, that means reduced here. ఒక ప్యాక్ కాల్చిన వాళ్ళు 20 years వరకు ఉండే ఎఫెక్ట్ 2 packs కాల్చిన వాళ్ళకి 10 years లోనే ఎఫెక్ట్ ఉంటది. అంటే హౌ డేంజరస్ ఇట్ ఈస్ అన్నది మనం అక్కడ వాళ్ళకి చెప్పాలి. ఈజ్ ఇట్ క్లియర్?
Yes, ma'am.
Audience.
Yes, ma'am.
Are you able
Yes,
to
ma'am.
understand this?
Yes, ma'am.
Okay, ma'am. Okay, thank you. Then prostate cancer at 50 years of age, we have to identify the Psa blood test. We have to send the blood for Psa testing. So I will tell you what is Psa is. Prostate specific antigen. This is prostate specific antigen blood test will be done for the individuals above age of 50 years. So at the age of 50 years, the normal range of this prostate specific antigen is nearly 4.0 nanocytes per ml of blood. But in the less than 50 years of age, the range should be 2.5 nanocytes per ml in younger man. That means below 50 years of age, ఈ రేంజ్ లో ఇవి ఉండాలి. ఏది పిఎస్ఏ యొక్క వాల్యూ. సో అలా ఉన్నప్పుడు దే ఆర్ హెల్దీ అని మనకు అర్థం. నెక్స్ట్ వన్ ఈజ్ టెస్టిక్యులర్ క్యాన్సర్. ఫర్ టెస్టిక్యులర్ క్యాన్సర్ వీ షుడ్ ఎడ్యుకేట్ దెమ్ టు హ్యావ్ testicular self-examination. So they have to, this procedure I am not going to explain to you because lack of time, short of time, and also we have to attend a meeting by 10:45. Sorry for that. Testicular cancer, in the testicular cancer, testicular self-examination, we have to explain them how to test their testes after bath. After hot water bath, the testicular sac will be very soft and they will be able to feel easily the testicles. So that's why they can easily find out any growths or pain or any swelling, whichever is present in their testes. Now we will go to the methods of cancer diagnosis. That is, various methods are there which we are doing in the lab. That is radiological diagnostic test, cytological, histological, frozen section, and hematological, immunohistochemistry, and molecular and tumor markers. So to see about each one in clear, so coming to the radiological methods, we all know very well about X-ray, there is ultrasound, CT scan, MRI, and PET scan. So these are the various radiological aspects through which we can identify the cancer, diagnose the cancer. And coming to the cytological, we can have the FNAC, for example, thyroid cancer and any growth that we have on the body. So from that, the FNAC they will do. What is FNAC? Fine needle aspiration. Fine needle aspiration cytology. That means they will utilize a fine needle and aspirate some of the fluid present in that growth, and they will send it for the testing. Okay, histological testing, and they will tell what is that, and we will find out what is that particular report of the test. Then histological, we all know that biopsy. So we will take the biopsy, a piece of flesh from the growth, and it will be sent to the lab, histology lab, and they will find out the report within 1 week or 10 days, and they will give which stage of which type of disease we have, cancer we have, and also the staging of that cancer. And next, frozen section. This is frozen section. What they will do in the theater, they will remove one part of that muscle, and they will froze it at the 20 degrees centigrade in the machine, freezing machine, and they will find out, they will study what type of cancer it is and what extent the staging of the cancer. Immediate report will be there. But whereas in histopathological and FNAC studies, we have to wait for 1 week or 10 days. But here, immediate report will be given with this frozen section. And hematological bone marrow testing will be done, and this will be done among the leukemia cases mostly. Blood cancers and leukemia cases, they will do the hematological test through bone marrow aspiration. Next one is immunohistological. Here, immunohistological study we will do on T cell or B cell monoclonal positivity test. That means T cell and B cell, we know that how it acts on the foreign antigens which enters into our body. So here also the cancer cells, when they act as the antigens, these antibodies, that is T cell or B cell, will be activated, and based on the positivity activation of the B and T cells, they will find out what type of cancer it is and what is that occurring in our body, changes occurring in our body. Next one is molecular. Molecular diagnosis is an ever-emerging field where they will identify the DNA studies they will do. DNA will be extracted from the our body who is going for testing, and they will do gene testing, genetic testing, and which gene is caused defected and which is going to happen in our body, which cancer is going to be affecting in our body. Next one is tumor marker. Nowadays we are having very advanced type of tumor marker testing, and here it is depicted in for lung cancer. We have CA125 and CEA marker. CA125 is cancer antigen. CA is cancer antigen 125, and CEA is nothing but carcinoembryonic antigen. So they will find out which antigen is present in our body through the blood testing. Okay. In liver cancer patients, we will find out AFP. AFP is nothing but the alpha-fetoprotein, presence of alpha-fetoprotein ratio in our blood. Next, prostate cancer, as I have said already, PSA is nothing but that is prostate-specific antigen. That a level of prostate-specific antigen will be tested through this marker. Then testing testicular cancer. In the testicular cancer, they will study for AFP as well as HCG. AFP, I told you already, that is alpha-fetoprotein ratio, and also HCG, human chorionic gonadotropin. So human chorionic gonadotropin ratio, they will find out if it is abnormally increased, then they will identify which type of cancer we have in our body. Next, coming to the breast cancer, here also we will undergo for CA125 marker and also CEA marker, and we will also have HER2 marker. HER2 means human epidermal growth factor receptor 2. Human epidermal growth factor receptor 2 marker. Then in the stomach, as I told you already, CEA marker will be identified. That is carcinoembryonic antigen. Even in colon cancer also, CEA will be tested. Pancreatic cancer, CA125 and CEA, and ovarian cancer, CA125 and CEA. Based on the marker changes, they will be doing this. Among breast cancer, we are going to do CA 15.3 and CA 27.29 are the tumor markers for breast cancer. So based on this presence of the tumor markers, we will be able to identify which cancer is present in our cancer cells are present in our body. So this is in brief about the diagnosis of the cancer diseases. And in the early stage, what we are supposed to do, and during the after detecting some difficulty in our body, then we will go to the diagnosis, actual diagnosis through various things which we have discussed now. Now going to the staging of cancer. So after undergoing all these investigative procedures, we will come to the staging of the cancer in our body. So this staging, according to the American Cancer Society, they have given like this: stage 0 or stage 0 or carcinoma in situ. So this is where the abnormal cells are found only in the first layer of cells of the primary site and do not invade. So wherever it is, for example, if it is cervical cancer, this invaded cells, abnormal cells will be found only in the cervical area. It's first layer of the cervical area. It will not invade into deeper layers, or it will not be going into the other parts of our body. So this is called as stage 0 or carcinoma in situ. Stage 1. Again, the stage 1 is divided into 2. Let us see what is stage 1. Stage 1 means this cancer cell involves the primary site but has not spread to nearby tissue. So in the stage 1, the cancer cells will be involving in the primary site. That means if cervical cancer means in the cervical area only, cervix only, in the deeper layers of cervix only. It is not going to spread nearby tissues. In that stage 1A, the visible under a microscopic examination is found deeper in the tissue. That means it is visible. Under microscopic examination, we will find out that it is entered into the deeper layers of that particular organ. Stage 1B is a large amount of cancer is found in the tissues. That means in the same organ. That means, for example, in cervix, in the deeper areas, large amount of the cancer cells are present in the deeper tissue. Then we can stage it as stage 1B. Arthamaitandamma?
Yes, ma'am.
Yes, all of you are getting, ma?
Yes, ma'am.
Sorry if I am speed, because of
No,
time I am going speed. So
no,
please try to understand. Stage 2. In the stage 2, cancer has spread to nearby tissues but still inside the primary site. So nearby tissues kuda spread avutundi, but primary site lone inka adi ekkuva invade kuda ayi undi. Ekkuva invade avadame kaakunda పక్కన ఉన్నటువంటి వాటికి కూడా కొంచెం స్ప్రెడ్ చేస్తుంది. అది మళ్ళీ మనము స్టేజ్ 2A, స్టేజ్ 2Bగా మనం డివైడ్ చేయొచ్చు. స్టేజ్ 2Aలో ఏంటి అంటే క్యాన్సర్ హ్యాస్ స్ప్రెడ్ బియాండ్ ద ప్రైమరీ సైట్. ఆ ప్రైమరీ సైట్ అంటే సర్వైకల్ జోన్ నుంచి మనము కొంచెం పక్కన ఉన్నటువంటి ఆర్గన్స్ ఏవైతే ఉన్నాయో ఆ ఏరియాస్ కూడా కొంచెం అది స్ప్రెడ్ చేసినట్లయితే దాన్ని మనము స్టేజ్ 2A అని అంటాము. స్టేజ్ 2B అంటే క్యాన్సర్ హ్యాస్ స్ప్రెడ్ టు అదర్ టిష్యూ అరౌండ్ ద ప్రైమరీ సైట్. అంటే అదర్ టిష్యూ అంటే ఫర్ ఎగ్జాంపుల్ ఇప్పుడు సర్విక్స్ లో నుంచి యుటిరస్ లోకి వెళ్తుంది. సర్విక్స్ లో నుంచి కొంచెం ఎక్స్టెంట్ యుటరైన్ బార్డర్కి వెళ్ళినట్లయితే మనము స్టేజ్ 2A అనుకుందాం. సో ఎగ్జాంపుల్ చెప్తున్నాను నేను మీకు. స్టేజ్ 2B అంటే డీపర్ గా కూడా ఇంకా లోపలికి ఆ ఏరియాకి కూడా బాగా స్ప్రెడ్ అవుతుంది. దాన్ని మనము స్టేజ్ 2Bగా చెప్తున్నాం. స్టేజ్ 3. సో క్యాన్సర్ హ్యాస్ spread throughout the nearby area, total area of the nearby tissue. Ante edaithe nearby organs unnayo, for example cervix ku nearby uterus undi, tarvata ee vaipu chusinatlaithe manam tubes unnayi, ee vaipu chusinatlaithe ovaries unnayi. So kabatti denikaina kuda any tissue will be completely extended to that particular tissue whichever is present to nearby to that particular organ where it has started. Next, coming to the stage 4. Stage 4 low cancer has spread to other parts of the body. Danlo A and B undi, stage 4A and stage 4B. Stage 4A lo emoutundi ante cancer has spread to other organs which is close to the affected area. So close to the affected area, మనం ఇప్పుడు సర్విక్స్ అనుకుంటే క్లోజ్ గా ఉన్నది యూటిరస్. సో దానికి యూటిరస్ అనుకుంటే యూటిరస్ లో క్యాన్సర్ స్టార్ట్ అయితే క్లోజ్ గా ఉన్నది ఇటు సర్విక్స్ కావచ్చు, అటు ట్యూబ్స్ కావచ్చు, అటు ఓవరీస్ కావచ్చు. సో క్లోజ్ గా ఉన్నటువంటి పార్ట్కి ఏరియాకి స్ప్రెడ్ అవుతుంది. దాన్ని మనము స్టేజ్ 4A అంటున్నాం. స్టేజ్ 4B అంటే క్యాన్సర్ హ్యాస్ స్ప్రెడ్ టు డిస్టెంట్ ఆర్గన్స్ ఆల్సో. దీన్నే మనం మెటాస్టాటిక్ స్టేజ్ అని కూడా అంటున్నాం. సో మెటాస్టాటిక్ స్టేజ్ అంటే ఏంటంటే ఇట్ స్ప్రెడ్ త్రూ ద సర్క్యులేషన్ టు అదర్ పార్ట్స్ ఆఫ్ అవర్ బాడీ ఆల్సో. ద క్యాన్సర్ సెల్స్ will be detached and it will be spreading to other organs and it will be lodging as cancer in the other organs. For example, ఈ cervical cancer brain కి వెళ్ళిపోవచ్చు, లేదంటే లంగ్ కి వెళ్ళిపోవచ్చు, లేదంటే థ్రోట్ కు, మౌత్ కి, లివర్ కి, స్టమక్ కి, ఎక్కడ పడితే అక్కడ బ్లడ్ సర్క్యులేషన్ లో దానికి ఎక్కడ ఇంట్రెస్ట్ ఉందో ఆ ఏరియాలో పోయి లాడ్జ్ అయిపోయి ఆ ఏరియాకి క్యాన్సర్ ని కలుగ చేయొచ్చు. So that will be called as the stage 4B. Okay, metastatic stage. So this is in brief about our topic, how the cancer will be diagnosed through step 1 and step 2. In the step 1 we are having awareness as well as we are going to have the warning signs. We identify warning signs. In step 2, we are going to go to the hospital to have the clinical evaluation and complete diagnosis through available diagnostic procedures. Okay, so that is second step, and also in that, based on the reports of the laboratory, then we are going to analyze it, the staging of the cancer, whether it is 0, 1, 2, 3 or 4th stage. So based on the report, we are deciding the disease, which stage it is, cancer in which stage it is. Is it clear?
Yes, ma'am.
So now I am waiting for the questions. If you have, you please come out with the questions so that we can have the discussion on the questions.
Thank you, ma'am. It's really our pleasure to grasp the knowledge shared by Mrs. K. Varalakshmi ma'am regarding screening and diagnosis of cancer, and she explained very well about the warning signs of different types of cancer, and madam gave a very detailed information about the tumor markers, and people with HPV vaccination also should go for screening recommendations. It's a very useful and very informative section. Thank you so much, ma'am. Even though you are busy, you had spent time with us to share our presentation. Thank you, ma'am. Any doubts? Any doubts from audience?
Good morning, ma'am. I have a doubt. Myself, R. Bhuvanasari. How can we encourage the rural women for regular screening for cancer, ma'am?
Yeah, as a health worker, we have our responsibility to educate them. They have their own, they have to tell first how to do the self-evaluation as warning signs. We have to educate them regarding warning signs continuously so that any deviation from the normal, if they have, immediately they should go to the primary health center, whichever is available for them, so that they can have the detection of the clinical evaluation. So from there, they can refer the case to higher institutions to have further diagnosis.
Thank you, ma'am. I'm
Okay. Any
requesting
more
any of the students. I'm requesting any of the students or faculty to give feedback about today's session.
Good morning, ma'am. Thank you so much for great presentation with lots of opportunities to ask questions. Today's session has put our minds at ease. The session was very informative and helpful, ma'am. Once again, thank you so much for the good information.
I couldn't get you. You have any question, ma? Queries?
No, ma'am. I'm just thanking you for the session. Thank you so much, ma'am.
Okay, any doubts from participants, students, or faculties? If any doubts, you can ask now, or we can wind up the session. I think everyone is very clear about the things, whatever you have shared today, ma'am. So I request Mrs. Bhuvanasai tutor to deliver vote of thanks.
Good morning, everyone. I am Mrs. R. Bhuvanasai, working as a tutor in Sri Vidyaniketan College of Nursing. I am here present the vote of thanks. I would like to thank our management of Sri Vidyaniketan College of Nursing for encouraging to conduct this program. I would like to thank our webinar speaker, Mrs. K. Varalakshmi Madam Garu, for sharing and enlightening us with her knowledge. Today's webinar was full of knowledge and interesting things. The point where Varalakshmi Madam told us about the screening and diagnosis of cancer. I would also like to thank our principal, Dr. P. Pratibha Madam, for encouraging us to organize this session. I want to thank the committee members who really worked hard to make this event successful. Also thank to all the students participating and paying your attention for this session. Thank you, ma'am. Once again.
Thank you, ma'am.
Thank you very much for the principal, ma'am, and also the faculty of your College of Nursing, as well as the student participants and staff participants. Thank you once again. Okay.
Thank you, ma'am. Madam will call you later, ma'am. Madam cannot able to join. She just know she messaged me, ma'am.
Okay. Thank you.
Okay, ma'am. Thank you, ma'am. Okay, soon we will all meet again with the next interesting topic. Stay safe, stay healthy. Thank you for all.